I'm Dr. Payal Mukherjee. I'm an adult and paediatric ENT surgeon with a special interest in hearing and balance disorders. I work at the Sydney ENT Hearing and Balance Centre, which is located at the Sydney Adventist Hospital. One of the particularly exciting innovations in ENT is to be able to use three-dimensional technologies, whether that's virtual reality, augmented reality, or 3D printing. 3D printing is particularly powerful because it's a very powerful tool to be able to communicate to patients, particularly my patients, a lot of them who have quite significant hearing loss and are already impeded in that communication pathway. To be able to take a normal patient's scan, to be able to 3D print their bone or a bone and show to them in real life on a plastic model what the surgery is going to involve really helps cross some communication barriers. For example, this is a print that I've done of a patient's ear, and it's great because we've been able to print not just the skin, we've also been able to segment out the bone and print the bone separately, on which I've done cochlear implant surgery. ENT is particularly exciting because we have a lot of anatomical challenges, and in that 3D technologies, whether it's virtual reality, augmented reality or 3D printing, is a particularly powerful way to communicate information to our patients, especially my patients who have hearing loss, so their communication pathway is particularly impeded. So to be able to demonstrate that in a 3D model really crosses a lot of boundaries between the two of us, between the patient and myself. So here's an example of a 3D model that I've done, which this is a model of the ear, and what I've been able to do is print the skin of the ear and the bone of the ear separately, on which I've done cochlear implant surgery. And this is called the temporal bone. This part is called the mastoid bone, and that's the ear canal of the ear. And I've been able to perform cochlear implant surgery on this bone. So what I can say to the patient is, look, when we start off, we make a cut in the ear, we push the skin apart, we then expose your bone. This is the surgery that we do, these are our boundaries, and then what we do is we pop the implant in. The device looks like that. That's the electrode that sits within the cochlea, which goes in through there, and then when we put the skin back, we put the external device. The audiologist will put that the next day, which works just a bit like a hearing aid, and that's when you have hearing. And to be able to do that in a few seconds means that whether the patient's 90 or 50, they can see exactly what's happening, not just what they're seeing on the outside, but what's actually happening inside the ear. So sometimes I can use the 3D prints in preoperative planning, so particularly if there's any surgeries that I'm expecting will be difficult, or I may not be able to do it, or expect a complication. Maybe I'll be able to print that particular patient's bone, their own anatomy, and be able to do the surgery on the bone beforehand to work out whether this is possible, not possible, what difficulties we may expect, and have that conversation with the patient before we've even gone down the path of booking them for surgery.